Psalm 23, verse 1 says, "The Lord is my shepherd, I shall not be the want." Madam Minister-designate, I want to encourage you to depend on God, if confirmed, to serve our country and your countrymen and women within Liberia. I also want to urge you that you should not allow personal interest to supersede country interest. Do not allow personal interest to supersede the citizen interest and humanity as a whole within our country. Note that you're going to spearhead entities that life need to be cared for, and you need to help people to overcome their illness. So I want to encourage you this morning as you'll be testifying to these honorable men of our time that you do everything with due diligence and depend on God to lead. Let God be your shepherd. Because when God is your shepherd, you'll not be in want. You will do the best for our country and everyone that will in our country. May God help you to do so. Let's pray. And so, Father, we thank you for this morning. We praise you, Lord, for giving us the breath of life to stay here today. And even come, Lord, to be part of this all-important event of our country. Bless our people. Bless the elder of our time who have come, Lord, to be able, Lord, to question the minister-designate. Bless them to do so in the best way and in the interest of our country. We thank you. We bless you now. In Jesus' name we pray.
Thank you. So we're now for the sergeant to administer the book.
Bonifaced citizen of the Republic of Liberia, do hereby swear that the testimony I'm about to give and to my recollections is the truth and nothing but the truth. So help me God. Okay?
Thank you very much. On behalf of the Committee on Health, I'd like to welcome all of you to this hearing. This is a procedure in evaluating nominees that are sent to the Senate by the President. So today the process will be, after my remarks, the senators here will introduce themselves. This is a 10-member committee. However, all senators are encouraged to come and be a part of it, to participate. So you will see more than 10 persons here or less, depending on who is available. And the procedure will be that after the welcoming remarks, there will be self-introduction, so you get familiar with the senators that are in the room. As more come, we recognize them and introduce them to you. And after that, the nominee will be asked to make a statement indicating why you are the right person for the position of Minister of Health. So thank you very much and welcome to all of you, to your family, your supporters, and to the committee and all senators in the chief. Thank you. So we now open the floor for self-introduction and we'll start from my left.
I can see Honorable Chair, can you, I can see the senators on this side, the journalists.
Can you please lower yourself?
Yeah, I can see.
Please, you can go further so that the nominee can see you.
Thanks for your understanding.
Good morning, Madam Nominee, distinguished colleagues. My name is Abraham Darrell, and I represent Monterey County.
And I'm Augusta Chair
Senator Taba Mabade-Fakla, Grandkip Country Chair of this committee. Thank you very much, colleagues senators. So we'll now turn the floor over to the nominee for her statement.
Thanks, Honorable Chair of the members, for giving me the opportunity to introduce myself and give out the platform that my team and myself and my health partners have for this country. I'm Dr. Louise Kpoto from the native of Nassau County. I had my childhood education at Compound No. 2 Public School in Harrisburg, Nassau County. I was then brought to Monrovia by my parents and attended Seventh-day Adventist Junior High School. Upon completion of my junior high school, I entered the William B. Stockman High School where I obtained my senior high diploma. I then entered the University of Liberia where I obtained a BSc in chemistry and biology and subsequently a degree in medicine. After my MD, I worked at the GFK Medical Center and later pursued further education in public health from the University of Tulane in the USA, where I obtained a master's in public health with emphasis on epidemiology. I returned home and worked with the Ministry of Health and helped to establish the epidemiology unit and was appointed director of the unit. This unit formed the foundation of the now Public Health Institute of Liberia, commonly known as NFIL. During this period at the epidemiology unit and through surveillance and data collection, I observed a high rate of maternal and neonatal morbidity and mortality, predominantly due to poor obstetrics care. This observation motivated me to go and specialize in obstetrics and gynecology at the University of Nairobi, Kenya, where I obtained another master's degree of medicine in obstetrics and gynecology. I returned home and continued working at JFK and Redemption Hospitals as team lead of the obstetrics and gynecological department, respectively in both hospitals. There, I did training and transfer of skills to nurses, medical students, postgraduate doctors, and also went to public health facilities where I transferred skills. During these periods of my service, I observed that certain tropical diseases were neglected. Diseases such as filariasis, worms, onchocerciasis, and schistosomiasis. These neglected tropical diseases affected our people in the rural area. Again, when the opportunity availed itself, I decided to advance my study on these diseases and obtain a PhD in tropical medicine at the University of Liverpool in England. You will now observe that the trend of my studies in different specialties has always been driven by the need that I saw in the country. Also, through my studies, I continue to return and work with the government, not only giving clinical service, but training, transferring, and forming policies. When my services with the government ended, I served as a consultant and fertility specialist at the Medlin Clinic up to my appointment as Minister of Health-designate. I have served as President, University of Liberia Student Union also, President of the Liberia Medical and Dental Association, And I've also served on boards of JFK Medical Center and Council. Honorable Chair and committee members, I'm married to Professor Robert M. Kpoto, an orthopedic surgeon. I'm a mother of several children. I'm self-employed, an entrepreneur, and a philanthropist. Honorable Chair and committee member, I am privileged and humbled to be appointed as Minister of Health-designate to serve my country. I therefore want to use this moment to
Thank you very much. Distinguished colleagues, you have listened to the statement by the nominees. So the floor is now open for questions, comments, and interaction. But let me caution us that by 1 o'clock there will be another hearing. So instead of the usual 10 minutes, maybe we can start with 5 minutes since we don't have a full house. If we still have time remaining, then we can ask subsequent questions. Let me recognize Senator Tyler, member of the committee. Welcome.
You want me to start?
So you want to ask questions?
Am I doc not there?
I was very strong subject. He's got a very strong vision. He wanted to be like your medical system, second to none. I want to thank you for that. The first question I want to ask you, do you understand the enormity of the problem that you're facing as Minister of Health?
As Minister of Health designate, I'm a community member, and as an individual, I have been through the 3 stages of the healthcare delivery system in our country. As a patient receiving health care, as a doctor giving health care, and as an administrator participating in policy and decision making that affect the healthcare delivery system of our country. Therefore, I'm aware of the challenges. To mitigate the challenges with our local experience, passion brings desire to transform our health sector, making it second to none with no intention of pressing it.
I get 5 minutes, so you
They don't ask long questions.
I understand the enormity of the problem that the health system faces. You don't get to know. But I don't want you to do all the questions. We're going to take you over 5 minutes. I want to ask you, when I was coming here, I saw a lot of people behind you. I don't have to work behind you. Do you really know the reason why they came with you?
Yes.
Why are they excited? They seem to be excited.
The confidence that we have in this is not the first time that a health worker, I've worked with the health workers. When in the previous government, the president, then past president,
So you understand the reason. Tell me the problem right now. If I ask you what is the major problem in the health sector in Uganda, what you tell me? Identify to me 3 major problems that we need to solve to resolve the health problem.
The problem in the health sector is enormous. The 3 main problems are prioritizing the service delivery. The service delivery, the challenge that's in the health sector, the availability of drugs and services. So we need to rebalance it. Besides in the rural counties, the lack of X-ray laboratories and consumers is a problem. The second priority, the health workers' motivation. The health workers are not motivated, no motivation. According to the WHO, we should have the 54.5 to 1,000 population. So it's 4.5 health workers to 1,000 population. But like here we have health workers, skills health workers to 1,000 population. So with this, the health worker motivation is very important. The third priority is accountability. Health workers should be accountable for the hours that they are have been given to working within the health facility, as well as financial, as well as financial accountability. So the revenue generated should be accountable. These are generating revenue. The logistics and supplies that are placed. So
one major problem is if you go to JFK, for instance, or most of the hospital in Nigeria, you go to the hospital, there's a challenge of medication. There's a challenge of, okay, let me just combine, they send a chair trying to do the challenge of medication. Right now, the bigger problem is the hospital going around the country. One of the major problems is that we pay people on is the issue of the number of volunteers, doctors, or nurses in the hospital. Most people want to be on payroll, they're not on payroll. They can't get on payroll. See that thing that you have to look at. The volunteer doctors, you know, they can't get paid. Unless they told one patient goes down to volunteer doctors who are working and can't be paid. They are training more nurses. Who are training more nurses, so we need to accommodate them. So will you be happy if the government take all the volunteer doctors and put on payroll?
So I would definitely be happy. Why would be happy?
Something that you want to pursue.
And that should be done with the human resource audit. So once it's a human resource audit, and you look at the data that I have in the human resource, looking at the skilled worker, if it's commensurate with the payroll, then we do the human resource audit. After it has been completed, then we bring the volunteers worker on. Because as I said, the WHO recommendation, skilled worker to population hasn't been met. Even the doctors in the country, WHO recommends that 1,000 population. In that, we have approximately 400 doctors, 900 doctors, which 400 actively practicing in the government. So if you do the ratio, so we have doctors, so definitely, I don't know the hospital,
There's this issue that doctors, experienced doctors take the medicine from us and carry it out and drug sources. How do you intend to do that?
Honorable committee member, permits me to answer this question twofold. The first is my nature, and the next is the facility itself. My dear father always told me that when you are going somewhere, the first thing you pack in your suitcase, yours already. Whatever you pack in your suitcase first is your weight and your character. So when you go to when you're going to visit, and after you start unpacking your suitcase, the first thing will come out will be your waist, your nature, and your character. If you follow my nature, my character is one of giving. And what will give that thing? I give to the extent until my husband tells me that I'm humble to the fault. Whenever I go in a facility, when I see a need, I give to that facility now. I used to work at JFK before. I pay bills for patients that are unable to pay the bills. I have bought medication outside the facility for patients that are unable to buy medication. The young children that come with their parents, I'm giving food to the young children. I'm not saying that I try to enumerate what I've done, but that's the kind of person I am. I've gone to public facilities to work, and I have given to the facility stethoscope, ultrasound, just basic things for them to perform. So it's my nature. The second one comes to the question whether, so my nature is not really to take this on the facility. The next one is the facility itself. My husband is orthopedic surgeon, he is clinic. After I assessed my intro, after my services with the government, I went to medical clinic to work as a fertility specialist. I also participate in the management of the clinic. So now, I've already told the the administrator accredited that was not confirmed by this honorable body or all clinical practice as well as administrative work to focus on public service.
Thank you. First, I want to say congratulations. Given the passion you have to revamp our health system has compelled you to specialize at different levels in your intro and by saying your CV. And I'm quite sure you are quite aware of the current state of our health sector in the country. Just by going through your CV, you haven't left this country for more than 5 to 6 years in recent time. So you are quite aware of what is unfolding. You also retrospect on this current election, you'll find out that those that stood the torches were among the health workers. Their passion to get the center restored, had them standing and defying all odds to get a new regime. So I know the expectation in the sector you're going to take over. I know how some will resist you because they want the whole order to go on. They want to prove you wrong. So I've come to say congratulations, and we're going to stand with you in the Senate to support your vision. But just by saying you want to make this country health system to be second to none in the South region, it tells me that you're going to do everything humanly possible to put your best. And with that said, count on my support as chair on the Waste Means Funders and Budget Committee, with my team members. We stand ready to support you so that we can have a turnaround in our health system. That somebody will go to Manual Winship Clinic not to receive prescription paper from the health nurse, but to receive prescription drugs as per your diagnosis. So we are ready to help in that direction. Thank you, congratulations, you have my support.
Thank you, Honorable Senator.
Thank you. Congratulations on your nomination to lead our health sector. You know, I used to be Minister of Finance for this country, particularly at a time when Ebola ravaged our country and significantly impacted the progress we have made in the healthcare sector during that time. And then we just dealt with COVID. And recently we saw that a tanker blasted in Kpoto and burned a lot of people with no burn unit in the entire country to treat them. So we go from one incident to another for which we are not prepared. Do you have a plan that we can support to address these type of situations, emergency situations? That's my first question. My second question is, when we talk about healthcare, we tend to focus on healthcare at the national level, JFK, redemption, and the other hospitals, but we forget about rural health. In my county, for example, a very, very rural county, we have about 14 clinics and one hospital. The infrastructure has been neglected over the last 2 years. Not a single one of them have medicine. There is no connection between the clinics and the main hospital in Kpoto. And I'm sure that's the situation across the country. Do you
have a plan that sort of shows the network, that we have provided network, that in these rural sector facilities, in center where the attention usually is focused on in terms of resources. And then finally, when I was Minister of Finance, we committed about 13% of the budget to the health center. That number has sort of declined slightly, even though we have been told that the budget number has increased to around 7,800. How much money do you think you will need to double the size of our doctors over the next 6 years, the size of our nurses, the size of our midwives across the country, so that we can meet the healthcare demands for the population that has increased from 4.2 million to 5.3 million? Thank you.
Thank you, Honorable Senator, for that question. It's good that you were the finance minister before, so probably I will be coming to you to help to lobby with the government for increment budget allocation.
Thank you.
So you accurately said, look at the data from 2018 to 2023. In 2018, there was in the government allocation, 14.33% was for the health sector. In 2023, 9.71% of that budget for the health sector. So there's a decrease of about 5%, 4 to 5%. So we, team myself and the partners will be asking the government to appropriate actual government allocation after we have done an assessment. I can't really give you a figure now, but to get an allocation to help the already local system to be revitalized. We will also mobilize with both international and local partners. And we'll look at those institutions like JFK that are generating funds to ensure that the funds actually generated with facing government ready to help the country. So take for instance, you have a banking system at JFK where people deposit their money instead of the money going over the counter with cashier receiving money. That will help income generation for that particular entity. Also, as it relates to the financing, if you look at the health insurance scheme, if that health insurance scheme is looking for, because we intend to have a team look at the health insurance scheme, then those, the indigents, the elderly, the pregnant women, under 5 can have access to health care. So now, your question about the rural area. As it relates to the rural area, the first one we want to look at when we take office in the rural area, look at the 5 kilometer in the health policy that for communities should have 5 kilometers away from the health center. So we cannot do that alone. We have to look at the public works. Even if they make the road, if they do some work on the road, that the communities going to the health facilities, the roads okay, being 5 kilometers. We look at infrastructure for the health sector. We also look at the health worker motivation for the rural area. Because if the health workers are incentivized to go in the rural area, those that is served in the servers will also be happy to work in the rural area. For instance, we also have to have a multidisciplinary approach to that. Education has to come, because you have to have good schools in the areas for the health workers' children to go to. So sometimes we see them, the area is far off, the money that they have as salary is low, it's demotivated, the same in the county. So for the output to be felt, definitely you see them having poor output. We also intend, Honorable Senator, to do monitoring evaluation, because if you sign a contract in South Africa, it will go and I will be in this facility. Our oath as health workers, we are supposed to have this Hippocratic work, not because of money, but because of saving lives. So if you say that this is what I'm going to do, we as the service provider should be at those various facilities so the community can have our output felt. As it relates to the emergency plan, indeed the fire incident was very bad. It has sympathy to the families in Bon County, those that were affected in Bon County, for the death of those that were affected during that particular period. So once it happened, I started to think, because if you listen to my intro, I always like to plan ahead. Can we have somewhere just for trauma units other than that of JFK? Can we just, because if we have to build, it may take time. Can we just look at our building and say, this building, can we convert it for a trauma unit? I'm not even looking at only the burn patients, the motorcycle accidents, the accidents that will come from the keke. So the JFK doesn't have that capacity to absorb all these kind of cases. And besides the capacity of absorbing those cases, you need trained up workers. So burn units, if you establish a burn unit, you need health workers, nurses, health workers, doctors that need trained in infection control. So the problem that I saw when I went to go visit in JFK, when I saw those burn patients, were infection control. They were just in the ER. So being the ER, you have visitors coming in and out, and you have other patients mixed with them. So the burn unit, the infection, is the one that actually carry the burn patients. So when you have a patient that burn, they can have infection that will carry them downhill. So having somewhere, we have to look into it, set up a committee, and look at a trauma unit, which should include a burn center.
You also have one more minute, sir? Okay, thank you. You know, I thank you for your response. I have no doubt that you will do well, you know, in the health sector.
Thank you.
You can count on my support, and my support is based on the fact that you come to this job with, you know, with the lens of the culture of the health sector in our country. I hope you also understand the politics, corruption, and all of that in the sector and fix it. But clearly, you have control over the structural needs of the country. And I want to congratulate you and thank the President for nominating you.
Thank you.
So we have Senator Kpoto, then Duncan, Senator Tino. Sorry. Yeah, I'll wait for yours.
Chair, Madam Chair,
Yeah, go ahead.
thank you. Madam Chair, distinguished senators, I nominee for the position of Minister. I want to say you are welcome. I'm listening to you, your presentation, listening to my colleague, question and your response. So I'm going to reduce my consent from 15 to just 1 or 6. I'm just concerned, just quickly, if you have a proposal pending, you can just let me know. How are you going to address the issue about the drugs, supply of drugs in our hospitals, especially the rural hospitals? Are you going to introduce the cost sharing scheme, or are you going to make the government pay for free drugs throughout? The other issue is I want to know from you, do you have or will you have a clear policy in addressing a similar question Senator Margaret had among the moonlighting, okay, where doctors are working and then they have their own hospitals or clinics where they refer patients to their clinics instead of the government hospital. I mean, no disrespect to the doctors, when there are no equipment, when there are no drugs, obviously they have to save life. So they make an option, or I'm going to do how are you going to control that in your policy. With respect to the issue of disparity in your payroll system between nurses and doctors and clerical staff, I need to know whether you have a strategy or you will have one. In terms of the issue of the payroll public, I know there have been audits conducted over time by the CSA and that of the IAA. But honestly, I want you to go further, because whenever those audits are conducted, people come back and tell us that they are working and they are not counted. Okay? whether the auditors go to the site to see the people, or they stay, for example, in refugee camp in Fishtown and call the people to come from Glaro, where it takes you about 6 hours if you want to just take a walk. Maybe 2 days, sorry, not 6 hours, to get to Fishtown. People in the typical areas where they don't have network, and the auditor goes there and just sit in Fishtown and say, I've come to do hair count. So you have to look at that because these are critical issues that come after the audits are done. How are you going to address the issue about the level of quality assurance in our lab system? We've had incidents where someone told me that the easy way to get out of the clinic is if you have checked the entire system, you still get outside without typhoid malaria. So you have become commercial typhoid and commercial malaria. So we need to see, I'm concerned about that, about lab. Then the ethics of our health, our nurses, Redemption Hospital, JFK. How are you going to address that? People complain that some of them play the woman. I have an experience when I took a fellow who an accident occurred and no one was picking up, and I put in my car, took it to JFK. And as soon as we were getting the man into the emergency section, the nurse came out and said, well, the man already died. I was like, wow, are you spiritual? We just lifted the man up, and he said he's dead. I mean, they kind of cared, with our nurses in the hospital. I want to see the ethical issue, how you going to address that. And then also, I'm concerned about trying to digitize or make it embedded, if possible, about our private clinics. Okay, because if I was taking treatment at this clinic, and for some reason I have the one disease and I'm going to the clinic, my files, my records, can they be transferred? I think it's some kind of way, but somebody is difficult to do. I don't know if you have a plan for that. The last one I want to say to you, if you want to address the issue at first hand from the health sector, try to submit a budget to this Senate that is county by county. So we can know where our doctors and nurses are. We can help you find the goals. I'm very sure that if you start to do that, because we can give you the support. I'm a member of the Ways and Means Committee. There is a Liberia County, but we have been given so many support verbally at this legislature. So you yourself need to be able to start to engage on the low-hanging fruit first. Thank you.
Thanks, Honorable Lady Member, Senator, for those questions. Initially it says 6, but I think it's 8. So thank you for saying the budget that we should bring it to the Ways and Means, and we already foreseen that, and we will look at it. Thanks for that. If we are confirmed, we'll definitely come knocking at the door. As it relates to doing digital data for all patients in the country, it's a good idea, but sometimes it becomes challenging because of the electricity problems and just some human resource problems. But what we as doctors do is good that we usually consult all doctors, majority of the doctors. If there's a patient, if you are a patient in Bon County, and you came to me, Monrovia, and you said, Doc, this doctor did a surgery on me, and this is what happened, I will listen to you, but after you leave, I will call my colleague to find out what happened. So although it's not like digital that we do, I mean, maybe film is digital, but we do call and we consult. I will say, Doc, you did the surgery. The patient, this is a complication. What did you do when you went in? What you formed? And then I'll ask you to send the record of that patient. So sometimes the doctor will snap it and send it to us. So it's something good to look in. Once we have done the low-hanging fruits, then digitalizing the entire system can be looked into. So we'll take note of that. Quality assurance. As it relates to quality assurance, training, and training. Training, retraining, placing the right people in the right places. So I will have to come back to you, Honorable Senators, if I'm confirmed, to ensure that those health workers that are given to us are actually the ones that are supposed to be in local facilities. Because sometimes people's hands are tied and you bring incompetent person to the health sector. So the health sector is somewhere that we will be asking you to give your full support, but not to politicize it if you want the actual output from the health workers. So quality assurance as drugs, we'll work along with the Liberia Medical and Drug Regulation Center to ensure that they actually do what they say that they should do, to look at the drugs that are coming to the country. Because sometimes in the country you see that people will take medication for particular illnesses and then they still be sick. So the quality of the drug, sometimes you look at the drug, you just mash it and it just breaks. It's just very brittle. You don't know the quality. You see the quality just by looking at it. So medication has specific smell. So sometimes you open a packet and there will be no smell on this medication right there, and then you know that this medication is a fake. So we'll work along with that entity to ensure that we have the quality assurance in here too. Then we talk about nurses, playing Zuma and nurses. So if there is any complaint given on any health worker, it doesn't have to be a nurse, a doctor, any health worker, that complaint goes to the Liberia Medical and Dental Association. Dental Council. And this council is supposed to have been on the committee before to investigate fraud. Most of the time when you hear somebody comes to me and say, oh, Zach, I said, I usually disagree, I'm not going to go for this. So on the council, we have this committee that's supposed to take action.
Chair, can I just take in the point, please, just specifically on that? My concern, I agree with the point that there is a goal, and that is trying to solve the problem. I'm talking about how are we going to help minimize it's happening. This is happening.
Yeah, so if it's happening, you have a supervisor. The supervisor should give you warning. The warning should be sent to the overall. If you are caught doing that, you send to CSA that you're consistently and compromising the patient's health. Because usually what I tell people in the health facilities, I say, consider this patient as your mother. Consider this patient as your brother, your sister, or your aunt. Don't look at this patient just as a patient. Look at it as a breadwinner for the family. So if you look at, because if you don't take care of the health of a breadwinner and that person lost their life, it's about 100 plus more person and feeding that you have taken from them. So I look at patients holistically, not as a patient, but as an individual that gave to their family. So we will have to, these complaints, if you see something like that, if you are at JFK and you see something like that, please, Honorable Senator, give the complaint to the head of JFK. And clear policy of referring patients. So there is a policy, I think, already existing. It just has to be augmented, and also it has to be reinforced. Referral patients. I've seen patients that certain small clinics cannot really help this patient because of the monitoring aspect. They keep the patients in the facility and reach their last minutes of time as once they enter the referral hospital to die. But hear me, also, these clinics, when you want to go high on them, you will find out some of the people, the very big people in the society back in your clinics. So when you go there and you tell the health worker that's there, this clinic will take it to MTC, we have to investigate, they can do nothing to me, you know, in this clinic. So if the senators can give us the backing, I promise you, my team, myself, and the partners will ensure that you have a very vibrant health sector. You talk about drugs in the hospital, how we do cost sharing. So when I was young, I'm old now, so when I was young, there was this paying minimum, this drug recovery fund that was introduced. So we'll go to the government facility and we'll pay a minimum amount, and that amount is used to backstop what the government is giving. So that drug recovery fund, if it could be reinforced and could be started, that would be very good. Like for instance, to start that cost sharing, you have to talk to the community. Let's take for instance, you go to redemption. You just all of a sudden go and introduce cost. Say $500 for every patient.
So cut your answers short and to the point, please. Yeah.
So it's a good idea. It's already been piloted in Colamo Hospital, and we can show you, we'll bring that to the floor to this same body.
Thank you. So you have to okay, so Senator.
Thank you, Madam Chair. Madam Nominee, good afternoon.
Good afternoon, Senator.
Although I have very short speech to interact with you, I want you to remind yourself that you are honor of. Our first question, are you certain and clear with the resume you submitted to us?
Definitely, I am.
Good. Let's proceed. I love the medical person there, not any inclination or anything about the medical field. But I have some basic questions here. What's the difference between a medical doctor and a medical or a public health administrator? Do you believe that a medical doctor is fit to be a minister of health? Or should we look for somebody with public health administrative education and life experience? Do you think that's the question?
Thanks, Honorable Senator, for that very beautiful question. In medical school, we have a lot of public health courses. We even joke amongst ourselves why they don't give a dual degree, one in public health as well as one in medicine. Because the amount of public health course we do is equivalent to a master's in public health. I believe I, as an individual, have a public health degree from the University of Turin.
You believe?
No, I wanted to say I believe, but then I came back.
Okay.
I believe, then I just started to say I, as an individual, have a public health degree in epidemiology from the University of Turin, and also from the University of Liberia.
Now, talk about public health administration.
Yes, so just if I did not have any inclination of public health, a medical doctor can make a very good administrator. Why I say that? Besides the public administration that we're doing on medical school, we manage the other category of health workers. And if you have somebody who has no knowledge of medicine, placed in an administrative position because he being an administrator, I think will be detrimental to our health sector. Why I say that? Because the health workers will come and tell you something that you don't understand, as you say in your opening statement.
I want meat to my, the meat of the answer to my question so we can flow. I was asking whether it is a sound thing to have a medical doctor necessarily administering the administrative arm of the sector.
Definitely, Honorable Senator.
Okay, that was it. Madam Nominee, let me ask a very controversial question. What's your view on abortion? Question.
As it relates to abortion, Honorable Senator, my view is one of the view of the medical community, is that abortion should be done only due to medical related reasons. So for instance, if somebody has a heart disease, and that heart disease is severe and they cannot carry that child to term, there should be abortion done. So based upon medical reasons, as the public health law says, that's how I look at abortion is done.
So it would not be a sin, a crime, if this legislature passes a law on abortion for medical grounds. Question.
Definitely not.
Thank you. Few more. We'll move on. Minister, Madam Nominee. Okay, now you.
I said two more things. You have 5, you want 3.
Now I said I will give the other 2. Madam Nominee. This budget 2003 carries 74 million for the health sector. 55 million of the 74 was projected to and appropriated to the Ministry of Health in 2023. In 2022. In 2023, out of 74 million, 55 million was appropriated to the Ministry of Health. JFK, JFK have 6.2 million in 2022, and in 2023, 7.1 million. If you have done an overview assessment of the sector and the enormity of the issues that you may confront should you be nominated, do you think, have you done a general assessment to know what this amount is okay? Because 7.1 million at JFK, 10,000 times such more is not there, the same way because sometimes the public, first time hearing how much we really appropriate for some of these institutions. Have you done an overview of this sector, and if what we then appropriate is still okay, or you come with something a question? So there I won't have one.
Honorable Senator, I have spoken with financial experts as it relates to the budget. In 2018, the budget was 14.3%. 2023 is 9.71%. And the financial expert told me that majority of that budget goes towards payment of salaries. So I was kind of surprised, because if you get a good percentage of that budget, almost 50% going towards payment of salary, how will you do service delivery? So that's why it's very, very important to look at the human resource department, do a human resource audit to actually ascertain that those that are on the payroll are the ones that actually take the payroll.
Thank you. How many parliaments? This budget covers 75,000 for mental health and substance abuse units. And this budget is capped around 700 million. I have declared the budget to be something from mental health issues. Because if we budget or appropriate 75,000 for mental health, only issues with drug abuse and mental health issues. If we says even the budget needs cure, what's your view and what would be your grasp of this issue so that we can make the appropriate recommendation that including Madam Nominee? Let me state that you did not convince me on the question one of my colleagues asked, I think it was Senator McGill, about your ownership of a private medical facility clinic, and you now will become Minister of Health. What courage will you have to regulate all private clinics to conform to the standard that we seek to elevate our health sector to? Question.
Thank you, Honorable Senator, for that question. As it relates to the private facility, my husband owns a medical clinic. It has been operational for almost 30 years. I met him as we got married about 20-some years, and that clinic is still functional.
So he inherited
It hasn't been there for years.
Okay, good, now you are. Well, you got it covered for it.
So,
to regulate it?
Definitely, I have the courage, yes.
Okay.
As it relates to mental health, the budget, I agree with you that the budget is very emotional. The President, His Excellency Joseph Iwanberger, declared mental health as a public health emergency. And that declaration, you can see on the streets, you don't have to just look at the ghettos, the streets corner, and I think you also have something that you're doing with those with mental health. So I think it's very small. We lobby with the government and also our international partners to help us to augment this budget to improve the mental health of this country.
Thank you, Madam Nominee. Madam Chair, you.
Thank you. We can finish with the line before we come back. Okay, Madam Chair.
Thank you, Madam Chair. My nominee, let me add my voice to the voices of my colleagues to say congratulations for your preferment. I'm Senator Chair, Dustin Chair again, representing Southern County, and I'm the immediate past chairperson of the Committee on Health. And let me start by saying thank you for the yes vote been given for the abortion bill. We've been struggling with that, and I'm happy that you have confirmed that there is nothing absolutely wrong with having a therapeutic abortion. Is that what you said? Right. Thank you for that. Thank you for that. And we'll count on their support. I'm going to committee, so we'll count on their support in the future to help us with passage of the bill. Your predecessor worked very hard on it, and we hope that it can come to fruition. I read your CV, and I must admit it's quite impressive. It's impressive because it's good on the technical. You have 2 PhD. One, right? So the other one is NASA, right?
Yes.
Okay, one in tropical medicine is a PhD.
Yes.
Okay, one in epidemiology
Yes, sir.
is a master.
Yes, sir.
Yes, okay, thank you. Yeah. So I think that's good because that would be the focus of what I had in the ministry. That's actually for sake. So you are coming with a very strong background, and in my opinion, that is very good for the sector. Very good. But Madam Minister, from my experience as the immediate past chair of the Committee on Health, let me say emphatically that if you are confirmed, you'll be inheriting a dysfunctional and highly corrupt Ministry of Health sector. It didn't just start yesterday or 2 years or 3 years or 4 years or 5 years or 6 years ago. They've been there for a long time. In recent times, there was an issue with the support from the Global Fund. Who is the Global Fund? The Global Fund had money, millions, that missing or that misapplied. And there have been investigations. The donors themselves were involved. I have a report on my desk. And as a result of that, the Global Fund money is not coming directly down to the Minister of Health. I'm sure you're aware of that. Channel through an organization. In 2022, there was a huge consignment of drugs related to our country that was taken through the warehouse. We have a drug warehouse at the warehouse there in Forward. And when the drugs were delivered to the warehouse, the very day the drugs were delivered, I'm sure you heard of that, those drugs disappeared. The investigation was still over up to the time of the election. I hope you take that up. Including also revisiting the case application of the Global Fund and money. You know, this is part of our country. When people give us their money to help us, it is our responsibility to manage the money so that it is used for the intended purpose, that our people benefit, our people get value for money. But there are people in the sector there, the health sector, who use their positions to enrich themselves to the detriment of our people. And so go around the country and see what's happening in the sector. And I want to advise you to please take up time to go around the country, make it one of the priorities to go around the country and see the situation present health delivery system that we have. Please also go to the service. Most time, government officials tell us it's too far, they send deputies, they send other people. And if you think it's too far, then you don't take the job. I want you to go yourself, go to Riverside, go to Sino, go to Blanco, go to Maryland, go to River G, go to Gambia. These are far places. Please go there and do your own first aid assessment. So that you inform yourself of the problem we are having in the sector. Because I've been working with them. It's very serious. The challenges are so enormous. Too many of them. And most of them have to do with just this administrative matters. People are not just managing whatever they have. They loan money from the budget corporation. We don't know what happens to that. And there's another issue with the CHOs. I don't know what's the difference between a CHO and a county health services administrator. Because most of the CHOs, the county health officers, don't stay in the county. They spend most of their time in Monrovia running after a budget and doing procurement. They should have been in the county running the system, making sure that health services are delivered to our people. In my country, for example, we have 3 doctors. The CHO is always out. He's a means something there. And that was the part. I think it's better to do that now. I think it's doing better. And that was a situation I complained myself. And I initiated his Supreme Court for the county because he was always never there. He was always in Monrovia running the ambassador, doing procurement. Instead of giving that responsibility to the health services administrator. It's something that I want you to look at. So that if people stay in the county, they say they are taking assignment in the county, they should remain in the county. Do the work in the county. And those people are responsible for administration. Give them that responsibility to discharge their responsibility instead of going out to functions, leaving the running of the health system in the counties and spending most of the time in Monrovia. This is what and I'm happy that you spoke about transformation. I'm very happy about that. I'm very happy. And so my question lastly is, what kind of vision are you coming with? How do you want to transform the broken sector? Thank you.
Thank you, Honorable Senator, for the comments. And the transformation I talk about is actually what you also see service delivery, to ensure that the drugs and medical supplies are in the hospital. We monitor, as we just spoke about, CHOs leaving, we monitor and evaluate those that are in the county to be sure that they are there to do exactly what they are paid for and what contract, whatever contract is signed. So those are some of the transformation. As it relates to the issue of global fund, we have been looking at it, and when confirmed, I would ask the LACC, because from what I learned in the transitional period, that is LACC, the one that looking into that, ask them whether they can facilitate that so the people can get exactly what they desire in this country.
Thank you very much.
Yes, Madam.
Let's recognize Senator Kane.
Madam Norman, congratulations. The question I want to ask, and will seem funny, was educated. I want to know whether the Emory Hospital is a private hospital or a government hospital. 2, I want to know the function of the administrator in all hospitals, especially the Emory Hospital. 3, is it compulsory for you to be a nurse and be an administrator? That's my question.
Thanks, Senator. For that, for those questions. So the Emory Hospital should be a lower-end hospital. During our assessment in the transitional period, we learned it's a lower-end hospital. We don't know otherwise if we are confirmed with do further investigation. As it relates to a nurse being administrator, it's not in black and white that nurses are supposed to be an administrator. Administrators should be people that understand the system, we have good financial background, understand the health sector. So that's the kind of person we should have administrator, regardless of which country or discipline you come from.
Thank you very much. My advice to you, as nurses or doctors stay long in a hospital, you should try and check whether they are doing well or not. If they are not doing well, transfer them to another hospital and maybe they'll do better. For the Emory Hospital, Madam Nominee, for the Emory Hospital, we need to work together. I'm a mother, knowing the constraint that the patients are going through is a need. I work along with you, and I always advise all ministers that are coming here that I am a whistleblower. Anything I see out there, I will inform the minister first. If there is no attention, the report will be taken to the Republic, which will be the president in charge. Thank you.
Thank you, Senator Shannon. So we take Senator Donald. After Mr. Joseph will come.
Nominee, congratulations.
Thank you, Senator.
Is this the same Louise, Dr. Louise Kpoto, who are in law school?
Yes, this is she.
You are?
Mine will be very short. My first intervention question will be what are your plans as it relates to the construction of facilities such as nursing quarters or facilities for our health workers? 2, are you contemplating on introducing or reintroducing the in-service training for health practitioners? 3, what is your plan or the strategy you have in place to curb the old age problem or allegation of medical practitioners, doctors, nurses selling medicine or drugs intended for the hospitals and clinics? So let's start with those 4.
No, I'm not 3.
3? Okay, start with those 3.
The one that relates to plans for nursing quarter is part of the package for the health workers motivation. So we're working along with the county, along with the senators of both counties to ensure that the health workers have nursing quarters or quarters for health workers to be able to stay in the counties. The training, in-service training is very important, a part of the package for the motivation. Because somebody who doesn't have in-service training will not be able to perform as time goes by. So definitely it's very, very important. How to curb medications leaving the center is by monitoring and evaluation and by establishing M&E centers in each of the counties.
Thank you, congratulations again, you come up with.
Thank you, Senator.
Thank you, Senator. We have Senator Joseph.
Thank you, Madam Chair. Dr. Kpoto, good afternoon.
Good afternoon, Senator.
I personally do have a problem with doctors.
You do or don't?
I do.
Or do I?
I remember 2017, after the election, I suggested to the CDC-led government, don't take the doctor, look for an administrator. Because at then I was in the House of Representatives, I was not part of the Senate, and then they took a doctor. And today, again, Union Party-led government is taking a doctor. Dr. Kpoto, you are a very good worker. I'm interacting with you at JFK. Hours of negotiation during the strike actions of doctors, and it was successful through your intervention. Now you're going to be leaving a gap. You're going to be leaving a gap at Millie. You're going to be leaving a gap at JFK because you may not have the time to practice. I know you keep track on, your workforce, you want everything to be okay, and there's going to be a serious gap. I could be convinced, maybe Chief Medical Officer. What's your view?
Thank you, Senator Sir Joseph. I remember 2017, you also nominated me to be Minister of Health, so I don't know what you have to do. So, having said that, I stopped working at JFK since 2017, since 2018. My services were I left work. And with nothing, my husband runs a physician there, and he's actually the I don't know how to call him, but he has been in the healthcare business for a long period of time. And when this nomination was, I heard the nomination over there, we discussed it, and he promised that he would actually take the bring of them so that boy will not be there. And I've also trained a lot of people currently who's at living that can handle the affairs of them.
One of the situations at the Ministry of Health is the Chief Medical Officer having a dispute with the Minister of Health. That's an old age problem. What are you going to do? Or who you intending, who will you recommend to the President to be your Chief Medical Officer so that there will be no dispute? You guys will work together.
So that could be mitigated. The President or who's involved in assessment of credentials, talk with the Minister-designate to see who you can actually work with and who you have seen in the health sector that can carry the Ministry of Health.
If you are given a chance, who will you recommend?
Any persons.
Dad, I love the health sector because I actually have every year I put in a lot of effort towards the health sector. That's my passion. While working in the NGO sector, I was in charge of missions, medical missions as Director for Africa. So that is why I got all of those qualifications. And it's going to be difficult, but we're going to try again. We're going to try again so that you can make a difference. You are a good worker, but I think you need to keep an eye on who become your Chief Medical Officer. That's one of the gap there. And then what are you going to do in field? Are you going to focus on the curative or preventive aspect of the health sector? What do you think?
So I think both curative and preventive important. But if you prevent, then the curative is very expensive. So if there's more emphasis on prevention, you reduce the budget as it relates to the health care sector. Take for instance, vaccination for kids. So once the children are vaccinated, they don't have measles. But if you do not vaccinate them, they have measles, then there's a burden in the health sector to be able to treat the child with measles. So prevention should be actually looked into so we can decrease the burden that curative brings.
So you want to revamp the Enfield? You want to do something about that? So they take care of the preventive aspect?
I'll have to look at it critically.
Okay. And then the decentralization of the health sector, where you have doctors also serving CHOs, correct, right?
Certainly.
Yeah. And they have to focus on administrative activities in the county. They don't have enough of time to practice in the hospital. Do you think you want to, your administration as health minister, you want to maintain that policy or you want to make a change?
So
because my view is, like other country, if you pay the doctors very well, they will not think about administrative work. So what do you think?
So, I went to school in Kenya, and there I saw, I made a mistake, but I saw doctors getting the rural health facilities and the county hospitals, and they performed very well. So it comes back to the senator. If you place somebody in position because of competency, you get a good output. But if you place somebody in position because of favoritism, the output becomes poor.
But what I'm saying is that you will make it, how many more million then? 3 more million? I remember the community, so I did that. So, but again, that's your administration. I do have oversight and responsibility. I think we should give you the opportunity to serve. You have done well before at JFK in serving. A lot of nurses and doctors respect you. I believe, I told one of the nurses, some of the doctors and nurses, I hope, please, journalists, I hope that there will be no strike action. Because now we are giving you what you wanted, you want at the Kpoto, so it means that don't come and complain again that the Kpoto, we don't want that the Kpoto. So at all of the various health bodies in support of the nomination, can you confirm to this body that there will be no issue with that?
So, Honorable Senator, with your support, there will be no issues on the medical community.
Well, you are aware that it's not a miracle, so. Thank you. Councilor John will go, then we have Senator Smith, when he has to run somewhere before we come to.
Thank you, Madam Chairperson. My name is Senator Councilor Joseph Kpoto John, Senior Senator of Local County. Madam Nominee, let me congratulate you for your preferment. When I look in the hall, I have not read a CV, and it doesn't matter to me. Because I know you before you went to medical school. I know you as a person. And when I see Jimmy Pomeroy, I wonder he's here because of his unification party. Which we all were, we were seeing activism as part of his unification party at the University of Liberia. So when I see Jimmy Pomeroy here, I'm wondering here as a local elder, I'm a local elder, or here as a chairman of the State Unification Party. But we'll deal with that. But again, let me go quickly through the question I'm asking you. If you don't want to respond, you can write it down because you're going to get confirmed anyway. There is a problem with regional harmonization in terms of the drugs we found in Liberia, in Cote d'Ivoire, in Nigeria, and other places. I went to a hospital in one of the West African countries, I won't name it for have a reason. and they prescribe medicine for me. But when I come here, when I come to Liberia without medicine, when I finish it, it will take me around 2-3 days to find similar one to it. Or I buy it there, it's sent by DHL. Do we have your commitment to look into those harmonization? We call it regional harmonization. That's my first concern. There are a lot of volunteer health workers that are now on payroll, you address them. So please take it very seriously. If you don't have a direct response now, I'm going to call you back in the future. It's a sticking point. We'll not call you back in the future. So if you don't have it, when you take office, please put there on your branch banner. Banner. 3, medical doctors or health ministers who are doctors easily become the best among diplomats by virtues of dealing with donors and lifting the Liberian case to get more assistance. You become a de facto foreign minister. So, you should be on the watch because the former head minister of South Africa became foreign minister. Later on, she became AU chair. It is because of her vast engagement in the health sector. It's a very easy railroad, or it's an easy road to diplomacy. Now, my other concern, as someone who established the drug program in this country under one umbrella, it needs to be in every ministry until I took over. Now, the president has raised serious concern about the drug epidemic. Now, the sector is working in the rehabilitation sector. From the time we've been looking at this problem, the Carefully Rehabilitation Center is here to be born again. That's one. 2, we have 2 psychiatrists in this country. One is there, one is living, but very old can hardly see. Are you going to look into that? Will you provide a scholarship for psychiatrists, for people to be, because it's one area you need to have drug addiction, in a focus. You gotta have a psychiatrist. Is there an area to focus? Please take note of that, even if you don't have a response. So those are my perspective, and I have no doubt, and there's not in my mind, and you get confirmed, not because you are a local citizen by marriage, not because you're from a spring education party by history, but your own as a person, as an individual. I've been your father also. Your father was an assistant controller. You know that. You know that. And also, I will give him my right. I will give my right. Congratulations in advance.
Thank you.
Thank you very much,
Senator Smith.
Can I just, Chair, can I just, so Honorable Senator permits me to respectfully make few corrections. We currently have 4 psychiatrists in the country. I think we have 2, if I'm not mistaken, who's already psychiatric for the work of further. And postgraduates we have like 3 that's supposed to complete additional 3. Yeah, so there will be more room for that purpose. And as it relates to the regional harmonization, something I have observed, once you leave, it's always good to have your personal doctor in the country. They communicate with your doctor outside. So if you have your personal doctor here, you bring your medication in the country, show that medication to the doctor. Some of the names are generic names. So it would be easier for the doctor to understand the name of the medication and the composition of that drug to find it readily for you. So it's just my humble advice.
Well, no, all of that, but you can continue.
Thank you. Thank you so much for your comments.
Thank you, Madam Chair. My nominee, congratulations.
Thank you.
My name is Wellington Jimon Smith from Liberia. I chair the Senate Committee on Agriculture, Forestry and Fisheries. I'm a member of the DEFCON. I have some issues that I want to write down to address. One of the flagship programs during the regime of our league, especially for those of us from the interior of the country, was the ambulance services. What's the plan? We activate that. You should be able to help the interior people. Wheresoever they are, go, and then the ambulance will be there. My second concern, proliferation of health schools in the country. When people say that the health sector is weak, the foundation of that weakness is from the training. And we are expressing proliferation of health centers across the country. I want for you to speak to that strongly. My next concern having to do with the midwifery school, specifically in Israel and Nigeria County. What's the plan? Because most of our ladies that go there, sometimes we personally carry the burden to keep them there. Lastly, President Joseph Walker had declared drugs national emergency. I want to urge you, when you are submitting your budget, put a budget, put a line in your budget that the Senate will support. You set up the drug test, the team that came in and tested us, senators, to go in every school annually. That every student, once you are a student in both public and private school, it is compulsory. The government will finance that through the budget, the health team from school to school for the children to do their drug test. Thank you very much.
Thank you. Senator Taylor?
Thank you. Thank you, Madam Chair. I'm going to ask you just two questions. I'm only asking you two questions. Because you were preferred by the president, and we call you by here to answer to all as to why you're supporting the county center. So I'll ask you a question so that tomorrow when you come, you will not give me an excuse. Are you going to take part in the formulation of your budget? Because all my colleagues have asked all the beautiful questions, all bowing down to money. If there is no money in the health sector, you will not be able to perform. You will not be able to perform. Last year, we called the health minister. Every question we asked, they said we don't have the funding. When we try to push it very hard, he says to us that they give us a template. We have a template. We should exceed this amount in the budgetary allotment. Will you take part in the formulation of the budget to be able to be fit in your ideas as to how you want to run this country? in the health sector.
That's the first question.
So she can answer both.
All right. The second one has to do, have you done a survey to the rural area, to go as to areas that really need a health center to be built? For example, if you went to the Kumba region, coming all the way down, you cannot find a hospital.
Which area?
Kumba. Yes, Cape Town, Bapu, from the forest region, coming all the way down to the family. Last year, someone died on the road. They were watching the government hospital, they were coming, the person died, they landed by the now right on the road. I saw him that the vehicle crying in hospital. Have you done your survey to know as to what places that need actually a very good hospital? So that we can listen and very sure to help save our people. Thank you.
Please, 3 seconds. They issue all services free at the health centers. When you and I know they are not free, what's the ticket?
And so
Thanks, Honorable Senators, for the question. The survey of the rural area that hasn't been done. I promise you, if confirmed by this honorable body, I'm going to be your minister on the field, not office minister. I intend maintaining myself with the support of our partners to go to every county to ascertain what is affording to look at the challenges in those areas. From the health policy, it says that from one community to a health sector should be about 5 kilometers. What you are talking about saying somebody that I've also experienced it, I've seen it quite recently in Germany, a young girl in her early 20s. She was pregnant, they were taking her to a health facility. They walked 2 hours, and because she has some issues that the traditional midwives would not handle, she also passed. So you can rest assured that I will be a minister of the people and not a minister of civil. As it relates to the budget, definitely, because the only way that I can make an input in the health sector, as I said, I want going to be to make sure that the allocation, I work along with the finance people to make sure the allocation are appropriately placed where it should be. So definitely I'll be a part of that. The ambulance, this question, I can answer the question he asked. So he said that the ambulance service. So in our, when I was nominated, I thought through it, and we should have a minimum 2 ambulances per county. Minimum. And then that has to be done in collaboration with the public works. Because the road is difficult, the timing reaching to those health facilities is longer as compared to having better roads. So it's an intersectoral approach. When it comes to the proliferation of school, the High Commission of School will also work along with them. And with this honorable body, because some of the schools are schools that are known by honorable people. So when you try to chastise the school administration, they have to do better, employ competent people. They will tell you, no, we want to school, and then you become paralyzed. So to have a vibrant health sector, we ask the support of everybody and give us the necessary support.
Thank you, Madam. Let me recognize the protein.
Thank you, Madam Chair, distinguished colleagues here. I'm not here to ask a question. I'm very concerned about the health sector. And I think you know that the entire health sector needs reform. We're trying to introduce program budgeting. When we leave here today, I want to confirm, I would advise you to put your strategic plans together, including the programs for you in the sector, and tie that into the budget, so as you implement, the legislature can be able to track what you're doing on a regular basis. And I hope you take note, because we're not going to allow ministers to come here
and just tell us what they use, whatever they put in the budget for. If you do show programs, you might not stand a chance of getting what you want in the budget. So that should be your first assignment if you confirm this part. Thank you.
Senator Cyrus.
Good afternoon, everybody. Thank you and congratulations again for your preferment as Minister of Health. Well, most of the other questions, because of time, very brief, and besides, you and myself have a common meeting place. So we engage you in the analysis. But basically, I want to ask you a few questions that has to do with the staff of the Ministry of Health. Do we have enough doctors or health practitioners in the country? I'm asking this question because many a times I've seen people who said they have graduated from medical school or health education, but they haven't been given the opportunity to work. So it has been my concern as to whether we have enough health doctors. We have enough doctors for health education. But then on the other side, sometimes we get so the hospital are short of doctors. So if possibly so, it's an opportunity, as a senator for the great county of River County, and then you being a minister have the opportunity to introduce to this question to rest so that we have a fair understanding of what's routine. You want to answer that question? Kindly? Okay, so I've heard a very terrible story in Lofa, and when I was campaigning, I have to speak about that all the time. It has to do with our mothers and sisters giving birth on the way to the hospital. I see that as very unfortunate. So I have to campaign, and I'm working on providing some ambulances for some health centers, bigger health centers in Lofa County. But having used my international connections to have those ambulances coming in the country, how do we maintain them? Have you put, or will you put in mechanism to have these, not only the ambulances are really in the country, but other government, assets that will be given to the hospital? Have you put in some mechanism, or will you put in some mechanism to protect those assets? Because I could bring the ambulances and then it just in 1 year time is finishing long. So I've been thinking, how do we maintain these ambulances when they come into the country? I have a situation that I need to bring up to you. I haven't been to JFK for the last 3 years. Why? Because my mother got killed by a nurse in JFK 3 years ago. I tell you, my mother got sick and I took her to JFK, the VIP, in a private ward, and she had oxygen in her home. Overnight, the nurse on call that night was just 5 minutes away from the private ward. And around 3 a.m., my mother was struggling and the oxygen slipped. And the nurse did not pay attention to her after 4 hours. And she finished. She died for 3 years. For that reason, I haven't been to JFK for 7 months. Every time I see JFK, I feel the other side. I feel very traumatized. I don't know as to whether someone talk about it, how are you trying to deal with these nurses who will go on call and be on social media instead of doing the work? Because that's what happened. They never on social media. That nurse that night was on social media instead of doing her job, and thereby making my mother lost. The second concern I have, and the second issue I have with the health center is my son is a medical doctor. Graduated with coming top of his class, going to Russia, graduated top of his class. He came back to Liberia. The Ministry of Health said that he never had anything to employ him. He got frustrated. I had to put him on a sapin and gave him a vehicle just to be able to do voluntary work at here they were paying $50 US a month for medical doctor. he had to go through that situation for almost a year and a half. And I was really annoyed when he would spend money on a medical doctor in country, come from European country, top of his class, and he has not that opportunity. Right now he works for a hospital in Banga, a clinic or whatever it is. At this point in time he's doing his own some mission in Bakuru. But I'm disappointed that a medical doctor will come from abroad 1 year and a half and he's not paid or he's not being hired. So my question is, do we have enough doctors in the country for us to have a situation? Thank you.
No, we don't have sufficient doctors in country. The WHO ratio is 1 doctor to 1,000 population. If you look at the figures of doctors in this country, for like there's a person between 1 doctor to 25,000 population. So indeed we need doctors in this country. The ambulance, the maintenance, if this honorable body confirms us, will work along with the maintenance department in the various counties. That's why decentralization is very important, to be able to retain whatever being given to that particular facility or county hospital. I'm very sorry for the death of your mother, and I can rest assured that if I'm confirmed, these issues, when they come about, please don't keep it to yourself. Bring it to the attention of the administration, and we'll take it to the Drug Medical and Dental Council, whose responsibility is to look at medical malpractices.
Thank you.
Louise Radio. Stay here.
2 minutes now.
Okay, 2 minutes. And your photo. First of all, congratulations.
Thank you.
When I walked in first, I heard my colleague. The question I want to ask you, ask a question about if you move a hospital. Make it clear. Let me come to that. Mine would be a question about the health service first. The situation that health service is in Liberia, level degree, passion of the country, commitment. Today, from 2006 to 2018, the health sector was up to date. Minister, managing director, and all of the officers and all of the 2018 to 2023, the health sector is 10% compared with sub-region. It confirmed the administration will not behave like an outgoing Minister of Health and for whom hospital, instead of whom hospital getting the referral hospital in Liberia, for example, the country with almost 200,000 residents. Today, you have only 1 ambulance, and the ambulance is restricted to 2 categories: very old and old people. We're not talking about Kpoto, man. We're not talking about district council, we're talking county.
Thank you.
Yeah, not 2004 for River County. My minister, today in Liberia, clinics, to even write a prescription, yourself will buy a sheet. In Liberia, I don't care about other counties. Even the federal hospital in the entire report of JFK, you understand it? Very simple. The degree of Ezra, the title you refer to a law clinic. Let me ask you, the money, the fees that they are collecting from JFK, they are not being captured in our budget and no medication in our hospital. What are they going to do with the money? What will you do? If confirmed, what will you do with the money?
Thank you, Honorable Chair. See your passion for your county and for improvement in the health sector. I've never worked in administration in JFK, so I can't comment on how they spend the money received for services. But what I want for you to rest assured that if confirmed by this body, I would like for us to establish a banking system that generally has where money is being deposited and given to government revenue instead of over the counter receiving cash and depositing it at the end of the day for the government.
Thank you very much. But please, I want you to have passion for your job and put that job first. I heard you say your husband owned a hospital, but I believe very strongly you are seeing a situation at the very your husband's hospital is a private sector. The one that when to take over from the outgoing Minister of Health. I always used to say all the particular not today. If you ask me to pray her, I give her 10% of the past 6 years. Because when you compare the institution that she had oversight for, JFK, all of the private hospitals and clinics are over at the French government. Or in a hospital, more preferable than any other clinic or hospital in Liberia. She took our taxpayer money to improve our whole sector. Please, nobody should convince you to say, man, this is your time, pay attention and pay your clinic in the country. Please, no Liberian, because all friends, relatives, they will come to you. You heard my police from South Africa. He told you the situation I was going through in the southeast and southern Liberia. Health, education, and road, these are the three major things that the people from Christ have and we need. So if confirmed, and you have to do the best of our expectation, Madam, there is tomorrow. You're not related with yourself, but you're going to the agitator called Kpoto. So any Kpoto appear in front of the Senate in the future, you say, are you related to that Kpoto who was then minister? So, Kpoto? Yeah, yeah, I'm talking about my sister. So, my dear, we will not judge you by your appearance, but we believe that you will do your best. If confirmed by the Senate, we will draw our police. Sometimes we go on inspection, and we believe that in the future, the situation in Ghana then will change in the next 3 to 4 months. Thank you very much. Thank you.
So thank you, Honorable Panel, for those recommendations and suggestions. You can rest assured that this health minister is a different person. I'm just appealing to this body not to put pressure on me when I'm making my decisions to say this is my auntie, or this is my cousin, or this is my friend. It's the appeal that I want to give me the support, and you have the health sector that you need.
Thank you.
Thank you, Madam Chair. Madam, first thing first, coming for information here, to call our time was in the hospital. What I meant to clap. Inside. Okay. Yeah, because that ain't the right word. So on a serious note. On a very serious note, the health sector, on a serious note, this is no problem. The health sector is strong. And I'm not saying this because this government just took over. You are a different administrator. The expectations will be high. You have to manage it, but you have to deliver. I hear you say you will not be a debt minister, but you have a confirmation, so you will say those things that we want to hear. Trust me, we will be after you and we'll go after you if you are doing the wrong things. And we'll give you the necessary support should you do the right thing. That we can count on. Now, this question about owning hospital or clinic is very key because most of our supplies are supplied from the new hospital to our private clinics or our hospitals. And that is wrong. In fact, it's a conflict of interest. Let me clear on that. Now, there are people assigned in my county, Liberia, who are on the payroll but are never in the county from the health sector. And there are other sectors I will speak specifically to this because I'm talking to you. They are never in the county, but they take pay every day or every month. And so you are sampled to the county, the next thing you know, one other doctor wants to be transferred or referred to Monrovia. Everybody will come to Monrovia. We need to guard against that. I would think that you should create some incentives that will allow people to be pulled to the county than staying in Monrovia here. Something in school, something called the push and pull factor. I think that would be a better strategy to help people want to go to the county because we'll get something else. Now, I've heard some people may have asked the question about just coming to the scene, so I will be repeating questions if that just means be patient with me. Now, our county have very few people in the hospitals, and there are too many volunteers in the hospitals. We need to either change these people's status and make them permanent, or we remove them from the list because they will keep striking, they will keep demanding, and the more you keep them there, these people will continue to be. Let's try to find a way around that and make the situation better for our people. I really don't have a question. I think that's what we should advise for you, and I'm looking forward to working with you in not too long. Thank you.
Thanks for the advice, Honorable Senator.
Okay, so now work with co-chair,
Thank you, madam. Please be assured we have the same 3 minutes. We are concluding this. Congratulations, Kpoto. I listened to all of the concerns. I think most of the concerns are asked, or maybe in light of emphasis, I may review. Madam, my first advice, one of your initiatives should be the act of encouraging people from going out of this country for treatment. You work with the JFK with all these problems. The past health committee initiated a project where all the operating theaters were being renovated, fixed, equipped by annual budget year. I think you need to initiate that project so that we can have a hospital that can act like a Kpoto hospital for people who have no reason to go to Canada. It's because of the facility not being here that why people are coming. I think we need to take on that challenge. My second concern is some of our colleagues, we who are from the rural areas, have already joined. People want to go to payroll because they were easy for the sick. It's simply they will have to come down the payroll because no health. But as soon as they get there, they come and start with the So I would encourage you to develop a motivating condition, maybe adult, the salary though, that will be in the rural areas, rural counties. You got some kind of incentive to encourage them to be there. Because treatment that provide here, the people in the rural areas are also entitled to those treatments. I want to encourage you that it's already a full disclosure indicated that your hospital controls or owns the main hospital. Please make sure government health policy that are implemented in health centers are also implemented by them. Ensure that the family. I want to, the idea of those are in the rural, those of us in the rural areas, accessibility of health facilities, especially the drugs. Can we regionalize the drugs, national drug service, and storage by region so that the health centers in the region can have access to quality drugs that are needed? I think it's also very important. Then lastly, let me talk about, sooner or later the chair will discuss with you about the health bill that's currently before the Senate. My concern that I've been advocating for is the issue of emergency patients. There are a lot of people that are dying whenever they are affected, attacked by hypertension, maybe
blood pressure and all of that. And when those patients are seeking health facilities, they are turned down. So when those in Yukuta, when they go to the hospital in Yukuta, they say no. Go to Monrovia, they go to JFK, they say no. Go to before they get to the 4th hospital, they give up. There should be a policy or a portion of the law that will ensure that health centers should receive patients, stabilize them, and only transfer them in the day after they are stabilized them. Even if they don't have the facility, but there are means that they can continue them, put them on camp there, and the following day they transfer them because people are dying from that. Madam Chair, thank you very much.
Thank you very much.
Thank you, Honorable. You can rest assured that we ourselves at health workers, we would like to see patients being turned away from the health center. So one team and myself, if they are confirmed, we will make sure that that doesn't happen. We minimize it.
Thank you very much. Thank you, police. Thank you, Madam Nominee, for responding to all of the questions. I think all the conversation here have been bringing forth the challenges that in the health sector, which you are not strange to. People are very, very concerned about. I heard across the floor statement that they use corruption in the sector, and that is serious. I'm sure if you are able to address that, most of the things that you have laid for as your vision will be achieved. Because the health sector is one of the highest supported material partners according to report services. And in many cases, you see that the situation is so appalling across this country. In my own Grand Cape County, there are health centers where you can't get few to run the generators. Women who are closer or have access, pregnant women, go there to deliver and they have to use phone lines because they cannot get free to turn the generator on, and the patient doesn't have money to provide. So these are serious things that we have to do. Also, a huge number of volunteer health workers that have visited many times here in this conversation. We need to look at that. I know it's a shared responsibility. So there has to be money available for you to be able to incorporate all of this. But we look forward to the plan that you present to us as a community in this country. One of which was to ensure that needed drugs are available across this country in all government health facilities. And we have this, I don't know whether it's perception or it's actual that health workers themselves, whenever drugs are available, they take them there. How do you think we'll be able to curtail that? Because even if the budget allows for drugs to be in the hospital, and those drugs are not managed well, we will still have the issue of not having needed drugs anymore. So how do you intend to manage that? The second thing that you spoke about that I'd like to bring to your attention is about health insurance, to mitigate some of the challenges of people not affording to pay their bills, for which my colleague just mentioned about turning back patients when they are in emergency situation. I didn't hear you talk about that. How do you want to work on that?
So thank you, Honorable Chair, for this question. How do we manage drugs in the hospital so they can actually be used for its intended purpose? We intend, first of all, to make drugs available. How we manage to make drugs available so they can be taken off, quote unquote, by health workers as is speculated around. Monitoring and evaluation is very key. Say for instance, we have a couple of paracetamol that has 1,000 pills inside. So that 1,000 pills, you cannot give all to one patient. So if you tell me this paracetamol is because the maximum I can give to a patient should be at 10 tablets. So if I'm giving 10 tablets, 10 persons took 10 paracetamols for in this particular cup, how many remains for the rest of the patient? We take your chart, we have a monitor evaluation team, I will take your chart and look at the chart, look at the diagnosis, see if they are accurate or if actually give this patient the paracetamol. So we have to go to the pharmacy and look at the chart, doctor's chart, take the pharmacy prescription, and be able to double check. Monitoring and evaluation of the drugs will be key. Honorable Chair would ask you that when at the time comes if you hear complaints from health workers or from people who say my family being threatened, my family being accused of taking medication is because of a check and balance. If confirmed, my team and myself and our partners will put into place.
Thank you. Thank you very much. I listen to you, I know you, a lot of people in the room know you. But I think the question goes beyond just you. You are going to be working with team, you are going to have doctors assigned at different facilities, many of whom have their private clinics and or hospitals. You have made commitment to this body based on your character, your own way of carrying yourself, the person you are, your integrity, but you cannot make that commitment on behalf of the other people. How do you want to make sure that they also follow suit?
So, Honorable Chair, as this question I started to brainstorm it, if confirmed, all medical doctors that are within the public sector that have clinics, they have to disassociate themselves from the clinic.
Thank you very much. You know, everything you are saying here today, you are under oath, and it's being recorded.
Yes.
This Senate, as a protein mentioned earlier, would be instituting a robust oversight.
Yeah.
So this confirmation doesn't end our public interaction, it doesn't end our community room discussions and follow-ups. So I just want to let you know that over time, we'll be calling you back and having these discussions, following up with the communities to ensure that in fact what you promised, giving the support, you are doing exactly that. Before I conclude, I mentioned earlier about the huge donor support to the health sector. But we see that maybe from the outside, that most of the support goes to areas that do not directly impact the people. To the point that several millions will come and all we see workshops. Health workers are going to this place to look for workshop. And when you look, the money go out, people don't even feel that they don't understand that this kind of money came and we are in the hospital, we don't have drugs. How can you, in your engagement with partners, in negotiation with them, try to redirect some funding on everyday needs of the people to make sure that the sector is, like you have put it, transformed in a way that it has not been in recent times?
Thank you again, Honorable Chair. That has also been my concern. So the partners, they have been very supportive of the health sector. So we have to sit on the table to know their support, where they say go. And also, I haven't really seen in the past whether the partners are also monitored. So if you are a partner, you say you're being Grand Creek County, you have the health workers there, whether the Minister of Health has an oversight to monitor these partners to do exactly what they said they were going to do. So we have to go around the table, discuss with them, and see how monies can be directed for the people to feel the impact. Because they have been doing very well supporting the health sector, but yet still see how much mortality rates and how near maternal mortality rates. So we have to work along with them. And we have to do our part as citizens that when these supports come, we do discourage the partners to say, because they have to work along with us. So we have to come in halfway to lead them, because there are some obligations that we have to give to the partner that hasn't yet been met. So we have to work, come halfway and lead them to ensure a vibrant health sector.
Thank you very much for answering our questions and concerns and all the comments you've made. The process of confirmation has stages. We have had this conversation. The committee of 10 members will meet after we have consulted. If there's a need, there are clarities we need from you, we invite you. After which our report will be submitted to the entire body, the Senate, to vote on your confirmation. If you are confirmed will communicate with the appointing authority to inform. Thank you very much and we wish you well.
Thank you, Honorable Chair, for the opportunity given me to sit in front of this honorable body and answer your questions. It was a pleasure interacting with you.
All right, so Dr. Louise Kpoto, Health Minister-designate for the Ministry of Health, have concluded her appearance before the Health Committee after being cross-examined for a few hours. So we'd like to say thank you so much for following us. That does it for this confirmation hearing of the Health Minister. Designate for the Ministry of Health. If a friend, you will manage the health sector of the country, which have been huge challenges, as expressed by the majority of the senators, some whom are from remote counties, rural areas, who are emphasize the constraint in those counties. So they confirmed that Kpoto will be inheriting these challenges and trying to mitigate some of the challenges in the various counties. So thank you so much for being with us. And you are the person as we close on this note to prepare ourselves for next confirmation hearing. The Director of the Executive Protective Service, UPS, and at 3 o'clock there will be the reappearance of the Minister-designate for Foreign Affairs, Cyril Nyanti Beslo. That confirmation will commence at 3 o'clock before the Committee on Foreign Affairs headed by Majorado County Senator Urban Darius. Thank you so much.